Okay, we're going to do an aesthetic crown lengthening here, and we'll look at this young lady who has relatively short central incisors. Measuring here, you can see that this measures approximately 8 millimeters in length for the right central. And if we measure the width, it's measuring a bit over 8 millimeters. We're approaching maybe 8.5 millimeters in width. So the tooth is relatively square in form. If you'll notice, the other central incisor is essentially a mirror image, approximately, again, 8.5 in width, and the length of it will be also about 8 millimeters. And if you look at the form of the gingiva, the central incisors have a relatively flat contour of the gingiva, and the level is relatively even with the patient's left lateral incisor, but on her right side, the right lateral incisor gingival margin is in a more apical position, as is the canine. So there's an asymmetry from left to right sides, with the right side being at a fairly good level, but you wouldn't like a lateral incisor to have a greater length than the central. So we will need to adjust the gingival level so that it is equal across the anterior and in harmony with the posterior region, and we'd like the central incisor margins to be somewhat level. Probe. And now, using a 15 blade and a round blade handle, I will make an internally beveled incision to outline the form that we would like, about 1.5 millimeters apical to the existing margin. So I'm starting on the distal aspect adjacent to the tooth and directing the 15 blade in an internal fashion. So this is an internal gingivectomy. And I made an initial incision from the distal, now one from the mesial, coursing back to meet that initial incision, and then work that around. And with a little bit of bleeding to mark that incision, I can align them and just retrace that line. The blade now is engaging bone and sloping toward it, so I've started coronal to the CEJ and worked toward the bone crest with the initial incision. Once I have that outline, which has now established a more highly arced position of the tissue, relatively level with the right lateral incisor, I'll make an intrasulcular incision, and that will free that collar of tissue and expose more of the anatomic crown. Now I can remove that collar with a curette and lift it away, exposing the tooth. And now you see a more desirable form of the soft tissue, as well as a more desirable form of the tooth. So there's central. And now with a 15 blade, I'll insert that at the line angle, this time distal, working toward the mesial with the initial portion of the internal beveled incision. And then I will work from the mesial back toward the distal, using the light bleeding from the margin to delineate that position, so I can align the mesial and distal incisions and join them. So once that initial incision is made, I'll make the intrasulcular incision to free the collar and then remove that with a curette. And now we have relative mirror images of the two centrals, and I can feel with the curette remove any little tags of two regions. So we have a good view of the osseous form prior to osseous surgery, and we're ready to start the osseous surgery. I'll use a high-speed handpiece with fiber optics and water spray through the instrument. There's a water bottle providing the water, so it's sterile water. And we're using a number 8 round burr, diamond burr, to do the initial gross bone reduction. And I'll simply reflect the cheek with a mouth mirror and reflect the flap with the Boozer elevator, so it's treating all the tissue kindly. You can see the flap elevation in the posterior region. And I'm just doing an initial gross bone reduction with a diamond burr, and it's moving it around, reducing the interproximal thickness and the marginal thickness, and getting an initial basic bone form without really changing the level. I'm tapering the bone toward the tooth, but I'm making certain that I don't touch the tooth with the burr. The final level change will be done with a hand instrument so that we don't damage the tooth surface. So once again, using the and now the surgery is finished, and you can see the exposure of the complete anatomic crown form, more attractive form, with a gingival level that is even across the anterior and in harmony with the posterior levels.